It's probably been about 7 or 8 years since I started getting, frequent headaches. And at first I thought it was just bad sinus infection. So I was actually seeking some treatment for that. But it was weird because I'd have them a couple days and then it'd go away and then it'd come back again. And luckily my doctor, Deb Johnston, investigated a little further and connected different hormonal changes as I age as a female that is connected to the frequency and severity of the headaches. So started the road of treatment that way. I get this pain like you would think a sinus infection would feel. I get this pain. It starts in the middle kind of my nose, and sometimes it's worse on one side than the other, and I really need to just take one of the pills right away if I can before it gets worse, because it's really hard. I think most headache sufferers will tell you it's really hard once you have a full-blown migraine to get on top of it. So it's a mixture of some different medications. Right now I take Relpax, which works really well when I do have a headache, so I just take that as needed. And I have about 6 to 7 episode or headache days a month, which is less than it used to be. And then there's just some different hormonal type things that my doctor has worked with me to help decrease the frequency of the headache and the severity that can be related to hormonal changes as women age. Before I got some relief and some different things that would work, I just would have 7 or 8 really bad days. And it wasn't just the bad day you have the headache, you usually feel pretty wiped out the day after, and that can make it hard to work. I don't skip work because of my headaches. I plow through them. I'm lucky to be able to do that, but there's different social things or events and things that if I've had a migraine that day, I just don't go to. I'm just not up to it. So I do know, though, that if one is starting, you can kind of feel it. It's like you just feel where it's going to start. That if I can, get on top of it and take something, then I can probably decrease the severity or the length of the suffering that day to a few hours as compared to, a full 24 hours. I think journaling things out and keeping track of what's going on, or even keeping a food and drink diary. Maybe you're triggered by some of those types of things. Maybe it's the stress in your life or whatever. But try to do something for it. You don't need to suffer unnecessarily for long periods of time. Sometimes there's not a lot that can be done, but I do know that our doctors can refer you to other places to seek even further treatment for the headaches.